For a healthcare specialist, managing and maintaining patient data for improved outcomes and enhanced care is vital. We are experiencing one of the greatest communication revolutions in our world's history. Yet for medicine, we still function in a highly administrative and isolated environment. With your smartphone, you can collaborate on just about anything, with anyone, anywhere. But within the medical community, there is still very limited global collaboration for patient care.
I'm very proud of our team because they've developed a brilliant platform to extinguish many concerns facing healthcare today. Our product was actually created by physicians for physicians who are really interested in achieving the best outcomes for their patients and ultimately being able to individualize treatment.
A recent federal survey found that 15% of 10,000 doctors responding said that EMRs had led them to choose the wrong medication or lab order. It takes on average 17 years for the results of clinical trials to become standard medical practice. The fact is, electronic medical record systems are the leading cause of physician dissatisfaction.
The difference between what Pulse offers and what an EMR offers are several things. We offer a holistic picture of the patient data. An EHR frequently is a standalone environment, and when you compare one EHR data with another EHR data, you can't combine them effectively.
Now health systems, payers, and suppliers are being incentivized and penalized to move from volume of services being paid for to reimbursement based on value and outcomes. With Pulse, providers, payers, and suppliers will have the information they need to succeed in this new environment.
We are truly focused on saving time, saving money, and saving lives. We're creating an integrated environment within healthcare where physicians, administrators, researchers, and pharmaceutical companies can collaborate to continuously improve the quality of patient care. We call what we do Connected Clinical Business Intelligence.
We pride ourselves on being the best little data company in the world. Unlike traditional archaic architectures that can take years to deploy, Pulse offers a modular, cloud-based environment that can be deployed in just a few weeks. The Pulse solution does four things extremely well. The first thing it does well is that it captures data. It captures data frictionlessly and doesn't force you to change the way you do your work. The second thing we do is we aggregate data. This means that we can take data from disparate systems, put it together, and give you a holistic picture of your patient. The third thing that we do effectively is analyze the data, giving you visualization. Each part of the care team has their own customized visual about how a process is supposed to occur and how well you're doing that process. And the fourth thing we do is report the data.
I've been working in oncology for many years, and specifically been working in the field of melanoma. And as a physician who sees patients with melanoma every day, we were frequently challenged with figuring out best treatments for our patients. We realized early on that even though we were introducing new treatments to patients, it was unclear as to how they were impacting their ultimate outcome. And by developing a system where we could track patients, not just at our center, but the centers across the country, we realized we could answer that fundamental question as to how our patients were doing.
The technology could really be one of the key game changers in medicine. As a preventive cardiologist, I want to educate my patients as much as possible when I see them. And I want to instill behavior change. That I believe is essential in order to maximize that office visit. But when they leave the office, I want to maintain that connectivity. This platform, this type of a technology will hopefully enable me to do that.
This is one of the most exciting times in the history of medicine, and frankly in the history of healthcare. Pulse is at the forefront of integrating technology with professional, communicative collaboration. And we do this cost effectively and entirely pain-free. Join us as we pioneer connected clinical business intelligence. We look forward to connecting with you.